Today we will be studying about forearm bone. On forearm, we will be focusing on radius and ulna. So, forearm is the part of the upper limb that extends between the elbow joint and the wrist joint. So, today we will be talking about radius. The radius is in lateral in position and is small proximally where it articulates with the humerus, okay, and large distally, whereas ulna is what just opposite to that, large proximally and what it is small distally. What radius is what? Radius is small proximally and large distally, okay. With this we have talked about radius and ulna, so we will mainly be focusing on the radius. Before going to radius, let us talk about the forearm, okay. As in the arm, the forearm is also divided into anterior and posterior compartment. In the forearm, these compartments are separated by lateral intermuscular septum and interosseous membrane, the attachment of the deep fascia along the posterior border of the ulna. So with these three things, what happens? The forearms compartment are separated by. Upper end is having disc-shaped head, while the lower end is what? Lower end is expanded with the styloid process. So upper end is what? Upper end is having disc-shaped head, whereas lower end is expanded with the what? With the styloid processes. You can see over here, what is this? This is interosseous border, okay. This is what? This is interosseous border, and this is what? This is anterior border, okay. So what is this? This is anterior border, and this is what? This is interosseous border, okay. Now what is this? This is anterior surfaces, okay. This is what? This is anterior surfaces. You can see over here, this is what? This is lateral surfaces, okay. This is what? This is lateral surfaces. This is what? This is anterior border, this is anterior surfaces, and this is what? This is interosseous border. Now let us rotate it to the on posterior aspect. You can see over here what happens. This is what? This is posterior border, okay. Here is what? Posterior oblique line, okay. So this is what? This is posterior border. So between the posterior border and the interosseous border, you can see over here what is this? This is posterior surfaces. So we have three surfaces and three borders, okay. At lower end, the anterior surface is in the form of thick prominent ridge, while the posterior surfaces presents four group for the extensor tendon, okay. So in the lower end, the anterior surface is what? Is in the form of thick. On the lower end, what happens? Anterior surface is what on the what? On the lower end, the anterior surface is in the form of thick prominent ridge, while the posterior surface present four groups is for the extensor tendons, okay. You can see over here, okay. And the surface border of the shaft is the medial border, okay. What is that? The surface border is what? That is medial border, okay. You can see over here. So this is what? This is medial border, which is what? Surface border, okay. Lower end presents a tubercle on the posterior surface is called as what? Dorsal tubercle of Lister, okay. This is what? Dorsal tubercle of Lister. So on the basis of upper end, lower end, surface border, and dorsal tubercle of Lister, we can determine the side, okay. Now let us talk about the feature. We have already talked about the upper end and the lower end. So in upper end, the head is what? The head is what? Disc shape and is covered with hyaline cartilage. The neck is what? The neck is enclosed by a narrow lower margin of annular ligament, and the tuberosity just lies just below the middle part of the neck, okay. The tuberosity lies just below, what happens? Just below the neck. So this is what? This is tuberosity, okay. Now let us talk about shaft. We have already talked about three borders and three surfaces. What are three borders? They are anterior border, posterior border, and interosseous border. Surfaces are anterior surfaces, posterior surfaces, and lateral surfaces. So on the lower end, what we can see? On the lower end, the anterior surface is in the form of thick prominent ridge. The radial artery is palpated along the surface. Okay, the anterior surface is what? The anterior surface is in the form of prominent ridge, and where the posterior surface present four groups. Okay, this is what? This is posterior surfaces present four groups. Okay, now the middle surface is occupied by the ulnar nose. Middle surface is occupied by the ulnar nose. Okay, middle surface is occupied by the, this is middle surfaces, you can see this is occupied by the ulnar nose. The lateral surface is prominent downwards to form the styloid processes. Okay, lateral surfaces is prolonged to form the styloid processes. The inferior surface bear a triangular area for the scaphoid bone. You can see over here, this is what? This is triangular area for the scaphoid bone. Okay, and the medial quadrangular area for the lunate bone. This area is for what? This area is for scaphoid bone, and this medial surface is for what? That is for lunate bone. Okay, now this is helping in the making of wrist joint. With this, let us talk about attachment. Okay, so the bicep brachii is inserted into rough posterior part of radial tuberosity. Okay, so you can see over here, bicep brachii inserted over this region. Okay, bicep, this is the insertion for what? This is the insertion for bicep brachii. Okay, supinator is inserted over where? Supinator is inserted over lateral surfaces. Okay, this is what? This is supinator muscles. So I have already talked, supinator is inserted on the upper part of the lateral surfaces, where the middle part of lateral surfaces give insertion to what? Pronator teres. Okay, this gives insertion to pronator teres. Whereas the brachioradialis is inserted into lowest part of the lateral surfaces, just above the styloid processes. Okay, here what happens, it gives insertion to brachioradialis. Okay, on the lateral surfaces there will be insertion of three muscles. What are they? You can see over here, this is what? This is what is this? This gives insertion to bicep brachii, and this gives insertion to the supinator, and this gives insertion to the what? This gives insertion to the, let us talk about what? Let us talk about flexor pollicis longus. Okay, flexor pollicis longus take origin from the upper two-thirds of the anterior surfaces. Okay, upper two-thirds of the anterior surfaces. This give origin to what? This give origin to flexor pollicis longus. Pronator quadratus is inserted into lower part of the anterior surfaces and into triangular area on the middle side of the lower end. Okay, so pronator quadratus, that is inserted into what? That is inserted into this area. Okay, this area is what? Anterior surfaces and into triangular area on the medial side of the lower end. Okay, on the medial side of the lower end. Okay, this gives insertion to what? This gives insertion to pronator quadratus. And let us talk about radial head of the flexor digitorum superficialis, that takes origin from the anterior oblique line. Okay, you can see over here what happens, there is anterior oblique line and what? And the upper part of the anterior border. Okay, so from the anterior oblique line in the upper part of the anterior border, it gives origin to radial head of the flexor digitorum superficialis. Let us look at in these things from where? From the this part. Okay, this gives origin to what muscles? That gives origin to radial head of the flexor digitorum superficialis. Abductor pollicis longus and the extensor pollicis brevis rise from the posterior surfaces. Okay, rises from the posterior surfaces. Okay, so from here what happens? What get originated, and from here what get originated? Okay, from here abductor pollicis longus get originated, and from this what happens? From this extensor pollicis brevis get originated. Now let us move to it anterior border. So what happens? The extensor retinaculum is attached to lower part of the shaft anterior border. Okay, so Extensor retinaculum is attached to the lower part of the shaft anterior border. Okay, now let us see in the this 3D view. So on this, okay, on the lower border, on the what, on the lower border of the anterior border, it gives attachment for the extensor retinaculum. Okay, this is give attachment to extensor retinaculum. So this is posterior view. Now you can see over here there are four group A, there are four group A group over here. So what happens in the first group, between the shaft crest like lowest part of the anterior border and the styloid process, give passes to what, abductor pollicis longus and extensor pollicis brevis. So you can find over here, so you can see over here, okay, this the first group between the sub crest like lowest part of the anterior border and the styloid processes gives passes to abductor pollicis longus and the extensor pollicis brevis. Okay, and this gives second group between the styloid processes in the dorsal tubercle gives way to extensor carpi radialis longus and extensor carpi radialis brevis tendon. Okay, and you can see over here the third oblique group medial to dorsal tubercle give passes to extensor pollicis tendon longus tendon. Okay, and the fourth group on the medial aspect, on the fourth group on the middle aspect, you can see over here gives passes to tendons of the extensor digitorum, extensor indicis, posterior interosseous nerve and the anterior interosseous artery. Okay, with this we have completed the four group and their passes. Okay, now let us talk about ossification. The shaft ossifies from a primary center which appears during 8 weeks of development. The lower end ossifies from a secondary center which appears during the first year and fuses at 20 years. Okay, and the upper end is what? Upper end is ossifies from a secondary center which appears during the fourth year and fuses at 18 years. Okay, with this we have completed ossification. I think we have covered everything. We have tried to cover the images. I think you have understood the things. So you can see over here, this is what upper wing, this is lower wing. Okay, this is shaft, it has three border, three surfaces. You can see over here muscle origin and muscle insertion. Okay, I think we have all understood. I have tried my best. If any query, we will discuss further on next video. Hope you have enjoyed the video. Thank you.